Hi all, here I am, your English friend with a new video to explain part A and B of sample 1 OET reading passage, which anybody can easily and freely download from OET's official website. So let's get started. Question number 1 in part A. Procedures for delivering pain relief. As we go through the passage, we can see that in text B, there are some points regarding what can be used to reduce pain under the subheading management. The first point says, splint the side of fracture or dislocation using a plaster backslap to reduce pain. And in the fourth subpoint, you may see administer analgesia to patients in severe pain. If not allergic, give morphine preferable. If allergic to morphine, use fentanyl. However, we cannot consider text B as the answer for question number 1, as there is no procedure explained anywhere in this text for delivering pain relief. As we move on, we may check text C, where we can find out a table which explains how the drug morphine, in this case, can be administered to deliver pain relief, or in other words, the procedure for delivering pain relief by using morphine has been explained in this table here. So answer for question number 1 is C. Question number 2. The procedure to follow when splinting a fractured limb. The term splinting can be found in text B under the subheading management in text B. Here, in the first point, you may see splint the side of the fracture or dislocation using a plaster backslap to reduce pain. But similar to what we have done with question number 1, we cannot consider text B as the answer for this question because there is no procedure mentioned here. Plaster backslap, which is used for splinting, as mentioned here, has been explained in text D. You may see the heading over here. Technique for plaster backslap for arm fractures. Use same principle for leg fractures. Points from 1 to 8 explain how splinting a fractured lip can be done. So answer for question number 2 is D. Question number 3. What to record when assessing a patient? This question is pretty straightforward. It's about assessing. In text B, we can find a subheading clinical assessment, and this is the location where they have taken this information from. So answer for question number 3 is B. Question number 4. The terms used to describe different types of fractures. Now this is a general information regarding fractures, so we need to check text A for that. Here we can find fractures. Buckle or break in the bone often occur following direct or indirect injury, example twisting, violence to bones. Clinically, fractures are either closed, where the skin is intact, or compound, where there is a break in the overlying skin. So these are the 2 words to describe different types of fractures. Answer for question number 4 is A. Now question number 5. The practitioners who administer analgesia. That has to be in text C. Text C, yeah, in the very first line you can see, authorized indigenous health worker IHW must consult medical officer MO or nurse practitioner. Scheduled medicines, rural or isolated practice registered nurse may proceed. So answer for question number 5, it's C. Question number 6. What to look for when checking an injury? Checking an injury, something that can be related with assessment again. Here in text B, the subheading clinical assessment, under that you may find examine and check whether. So these are the things that we can connect with question number 6. So answer for question number 6 is B. Now question number 7. How fractures can be caused? Again, a general information regarding fractures. It has to be in text A. Here you may see fractures often occur following direct or indirect injury, example twisting, violence to bones. So answer for question number 7 is A. Question number 8. What should be used to elevate a patient's fractured leg? This question can be related with management of injury. In this case, management of leg fracture. So let's check text B, where we can find the subheading management. And as we go through the second point, you can see that elevate the limb, a sling for arm injuries, a pillow for leg injuries. So answer for this question is a pillow, or simply pillow can be written. So this can be written with or without the article, and both would be fine. Now question number 9. What is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route? Since question is about the dosage of morphine, it has to be in text C. And the drug they are talking about is morphine. Here you can find that, and the route of administration is IM. So here you will find the recommended dosage, which is corresponding to IM and morphine. So that's 0.1 to 0.2 mg per kg to a maximum of 10 mg. So the perfect answer for question number 9 is 0.2 mg per kg. So you may write kg, or if you don't want, you don't have to write, that would be completely fine here. 0.2 mg or 0.2 mg per kg. Both are going to be fine for this question. Some people might have doubt that why 10 mg cannot be the answer for this question. It is because the question is specifically asking about the maximum dose of morphine per kilogram of the patient, not the maximum dose. That's why it is not 10 mg. And you're not even allowed to write 0.1 to 0.2 mg per kg, because question is not asking anything about the range or anything about the minimum value as well. So the answer has to be 0.2 mg or 0.2 mg per kg. Question number 10. Which parts of a limb may need extra padding? Answer for this question can be found in text D. Here, in this part, in the 7th point, do not apply pressure over bony prominences. Extra padding can be placed over bony prominences if applicable. So question is about that part of a limb which may be needing extra padding. Answer for question number 10 is bony prominences. Now question number 11. What should be used to treat a patient who suffers respiratory depression? Answer for this question can be found in text C, because it is related to treatment. So here in the last part, you may find respiratory depression is rare. If it should occur, give naloxone. So answer for question number 11 is pretty direct. Answer is naloxone. Now question number 12. What should be used to cover a freshly applied plaster backslap? It's about plaster backslap, so answer has to be in text D. Here you may find in the last part, wrap crepe bandage firmly around plaster backslap. So the answer is, for question number 12, it is crepe, or it may be written as crepe bandage. Now question number 13. What analgesic should be given to a patient who is allergic to morphine? This information is not in text C, it is in text B. Here in the 4th line you may find administer analgesia to patients in severe pain. If not allergic, give morphine preferable. If allergic to morphine, use fentanyl. So answer for question number 13 is fentanyl. Now 14. What condition might a patient have if severe pain persists after splinting, elevation and repeated analgesia? It's in the same text in the 5th point. Consider compartment syndrome when pain is severe and unrelieved by splinting and elevation of 2 doses of analgesia. So answer for question number 14, compartment syndrome. Now question number 15. Falling on an outstretched hand is a typical cause of a dash of the elbow. This answer can be found in text A. Here, Dislocation is where a bone is completely displaced from the joint. It often results from injuries away from the affected joint. Example, elbow dislocation after falling on an outstretched hand. So answer for question number 15 is dislocation. Now 16. Upper limb fracture should be elevated by means of a dash. It is in text B because it's related to management. Here we may find subheading management. Second point says elevate the limb, a sling for arm injuries. Upper limb is the arm. So answer for question number 16 is sling. Question number 17. Make sure the patient is not wearing any dash on the part of the body where plaster backslab is going to be placed. As it is related to plaster backslab, answer is in text D. Point number 5. Ensure any jewelry is removed from the injured limb. So answer for question number 17 is jewelry. Question number 18. Check to see whether swollen limbs are dash or increasing in size. Checking, assessment. So it has to be in text B under the subheading clinical assessment, where you can find another subheading which is check whether, and in 1, 2, 3, third point, the limb if swollen is throbbing or getting bigger. We cannot write getting bigger because they have already given us the information increasing in size. So the answer is throbbing. Throbbing. Question number 19. In a plaster backslab, there is a layer of dash closest to the skin. So let's check text D. Here we can see that the first point, measure a length of non-compression cotton stockinette from halfway up the middle finger to just below the elbow. Width should be 2 to 3 centimeters more than the width of the distal fora. So cotton stockinette is the first thing which they use to apply on the fracture. So answer for question number 19 is stockinette. So it can be simply stockinette, or you may add cotton or known compression. So it can be cotton stockinette or known compression stockinette or simply stockinette. Now the last question, question number 20. Patient's age, dash and over should not be given the higher dosages of pain relief. Since it is related to dosages and pain relief, it is in text C. Here, the first point below the table you may find, use the lower end of dose range in patients greater or equal to 70 years. So our answer is 70, or you may write 70 years. You may even convert the number to words, but that won't be appreciated much. Even though you will get the mark, that's going to take a bit more amount of time. So writing in number would be a better option. So it is 70 or 70 years. Years is not mandatory because there is a term aged here. So it can be simply 70 as well. And there is one more thing that you need to notice when it comes to question number 20. Here we don't have to write or put the simple greater or equal to, because in the question they have given and over. So if we put the simple greater or equal, or if you write anything regarding that symbol here, our answer will be wrong. Question number 1 in part B. The manual informs us that the blood pressure monitor, here the answer is option B, may not work correctly in close proximity to some other devices. As we go through the paragraph, we can see that with increased use of portable electronic devices, medical equipment may be susceptible to electromagnetic interference. This may result in incorrect operation of the medical device and create a potentially unsafe situation. So, when medical equipment is kept close to portable electronic devices, it leads to incorrect operation, which is the same idea that we can find here, may not work correctly, or it may lead to incorrect operation when it is kept in close proximity to some other devices. In order to support the idea of close proximity, you may even consider the last line as well. Care should be taken to avoid the use of monitor within 7 meters of cell phones or the other devices generating strong electrical or electromagnetic fields, because if they are within the range of 7 meters, electromagnetic interference could occur, and because of that, blood pressure monitor may not work in the way it is supposed to work. Now let's consider option A and C. Option A says is likely to interfere with the operation of other medical equipment. It's actually contradicting the information that we can find here in this paragraph, in this extract. According to this extract, it is a blood pressure monitor which is getting interfered, which is getting affected by other devices. And option A says blood pressure monitor is interfering with the operation of other medical equipment, which is contradiction. So option A is wrong. Option C, blood pressure monitor should be considered safe to use in all hospital environments, which is an option which is not mentioned in this paragraph. There is no information which states that medical device or blood pressure monitor should be considered safe to be used in all hospital environments. There is no such information here. So that is also wrong. So our answer is B. Question number 2. The notice is giving information about. Here the answer is C. So option C says which staff should perform NG tube placement. This information can be found in the paragraph in this area of the extract. Insertion and care of an NG tube should therefore only be carried out by a registered doctor or nurse who has undergone theoretical and practical training and is deemed competent or is supervised by someone competent. So this is the information which supports option C, and that's why option C is the right answer for this question. Now let's deal with option A and B. Option A says ways of checking that an NG tube has been placed correctly. As you go through the paragraph, you can understand that the initial portion of this extract deals with the serious implications that could occur if the NG feeding tubes are incorrectly positioned. But they are not telling us anything about the ways of checking that an NG tube has been placed correctly. So this option cannot be the answer. It is a wrong one. Option B, how the use of NG feeding tubes is authorized. Again, another option or another information which has not been mentioned anywhere in this paragraph. They are not telling us anything about how the use of NG feeding tubes is authorized. Question number 3. What must all staff involved in this transfusion process do? Option A, check that their existing training is still valid. As we go through the paragraph, we can read, following the introduction of right patient and right blood safety policy, all staff involved in the transfusion process must be competency assessed. When we read further, we can find staff must ensure that if they take any part in the transfusion process, their competency assessment is updated every 3 years, which means staff involved in transfusion process must check that their existing training is still valid, or in other words, they must check that their competency assessment is still valid, or they need to keep that updated every 3 years so that it remains valid. So option A is the right answer. Now let's check why option B and option C are wrong. Option B, attend a course to learn about new procedures. There is no information about any such course which is meant to learn any new procedures mentioned in this paragraph, so that's clearly not given. Option C, read a document that explains changes in policy. Again, something that has not been mentioned anywhere in the paragraph. There is nothing about changes in policy or about a document that explains those changes in this paragraph. Question number 4. The guidelines establish that the healthcare professional should. Answer for this question is option B. Option B says, evaluate the need for a chaperone on a case-by-case basis. As we go through the paragraph, we can find that in the initial portion, A patient may specifically request a chaperone or in certain circumstances may nominate one, but it will not always be the case that a chaperone is required. It is often a question of using professional judgment to assess an individual situation, which means the healthcare professional should decide if a chaperone is necessary by assessing each case individually. And that is the same idea which can be seen in option B, and that's why it is the right option. Now let's deal with two wrong options, which are A and C. A says, aim to make patients fully aware of their right to a chaperone. No, this cannot be the answer because the healthcare professional decides whether or not a chaperone is needed. It is not the right of the patient. They may make a request, however, the healthcare professional take the decision. Now option C says, respect the wishes of the patient above else. It is also a wrong option because the healthcare professional takes the decision if a chaperone is needed only by assessing an individual situation, and it is not taken on the basis of what a patient wishes. Question number 5. The guidelines require those undertaking a clinical medication review too. Here the answer is option A. Involve the patient in their decisions. When we go through the paragraph, we can understand that to give all patients an annual medication review is an ideal to strive for. In the meantime, there is an argument of targeting all clinical medication reviews to those patients likely to benefit most. When we read further, here you can find, however, the guidelines go on to say that all patients should have the chance to raise questions and highlight problems about their medicines, and that any changes resulting from the review are agreed with the patient. Which means the guidelines say patients also should be involved in their decisions. So that's why option A is the right answer. Now option B, consider the cost of any changes in treatments. This is a wrong option because in the extract there is nothing about considering any cost of any changes in the treatment. In the last part you may see they are giving us an information that avoid the need for costly treatments by proactively managing patients to recover through the whole care pathway, and this information has got nothing to do with option B. So option B is wrong, or you may say something which has not been mentioned. And option C, recommend other services as an alternative to medication. That's clearly not given. There is no information regarding option C anywhere in this paragraph. Question number 6. The purpose of this email is to. Answer for this question is B. It says, explain the background to a change in patient care. When we go through the paragraph, you can see that the post-operative or the post-surgical complications were increasing. So for every 5,000 surgical patients, 25 were experiencing respiratory depression. And in the further lines, you may find a retrospective multi-center study of 14,720 cardiopulmonary virus cases showed that 44% were respiratory related and more than 35% occurred on the general care floor. In the last two lines, you may find, it is therefore recommended that post-operative patients now have continuous monitoring instead of spot checks of both oxygenation and ventilation. So this is a change. This is the change that you can find here. Post-operative patients now have continuous monitoring instead of spot checks of both oxygenation and ventilation. Moreover, from the very first line onwards, the reason for this change can be found. The post-surgical complications were increasing, and that's the reason for the change. And that's why option B is the answer. So option B says again, explain the background, or you may say explain the reason to a change in patient care. Now option A, report on a rise in post-surgical complication. This idea is there in this extract, but it is not the purpose of the email. Like I said before, from the first line, they are explaining the increase, or they are explaining all about the post-surgical complications, but not the rise in that. And even it was the rise in post-surgical complication, this is not the purpose. The purpose was not to make a report on the complications, but to explain them as a reason for the new change that they have made in patient care. And when it comes to option C, it says remind staff about procedures for administrating drugs. That can never be the answer because there is nothing about any procedures for administering drugs mentioned here in this extract. If you liked this video, please let me know about it through the comments, and don't forget to like, share and subscribe. You may click the bell icon to get prompt updates. Thank you for watching.